Hi, I'm joined by Janet Carter, and she's a registered dietitian with the Heart Health Clinic at MUSC. And Janet, welcome to the program.
Thank you.
Tell me a little bit about what the Heart Health Clinic is, because we've been talking about childhood obesity, and tell me how that fits in here.
The Heart Health Clinic is basically a pediatric weight management program, but we also help children with cardio preventative situations, like if they have high cholesterol, high blood pressure, and things like that, we'll help them with those conditions as well.
That sounds kind of overwhelming to talk about children and heart health and elevated cholesterol levels all in the same sentence. It's seeing that many of them?
Yes, actually. I mean, the majority of the children that we see do have weight issues primarily, but we do see children that have high cholesterol and high blood pressure. It sort of follows the pattern.
Yeah, it's the sequencing with the overweight child,
right,
of what
right.
happens.
And high insulin levels and things like that.
So what happens when they come to the Heart Health Clinic? What kinds of things do you do?
We basically teach them healthy lifestyle habits. We focus on eating healthy and proper nutrition. We also look at physical activity, and we do touch on some other things that may affect all of that, such as body image and time management and stress management. But we really focus on them having a healthy lifestyle so that they can keep all of those factors under control.
And what age group do you see?
We can see ages 2 to 20. The majority of the kids that we see are probably, I would say, roughly 8 to 13 is pretty much the majority of the kids that we see. But we do have, right now, the youngest child we have is 5, and the oldest we have is 19. So.
And you talked about, changing behaviors and everything. What kind of things do you do to try to help them to change because it's a whole lifestyle change for them?
Right. We talk a lot about goal setting, positive reinforcement, and we take things and break it down specifically. We look at if they're drinking high-calorie drinks, having junk food, and just in general trying to take small steps to get them to eat healthier and to be more active, and just in general live a healthier life, because a lot of them don't follow those patterns as well as they should be, and the parents may not as well. So we just really try to focus them on getting healthier.
Oh, and you mentioned the families and the parents. Are they part of
Absolutely.
the process?
Yes, it's a family-oriented program, and we encourage the family members, anyone involved in the child's life, to be involved in the program as well. And the parents are in the visits, the parents come to the group sessions with the children, and we focus a lot on what the parents can do to help the child and how the dynamic can change and things like that. Because a lot of times there are issues of certain parenting issues like discipline situations or divisions of responsibility that aren't quite what they should be for these situations, and so we do work on that as well.
Mm-hmm. How do you go about addressing the specific issues surrounding the child's food intake and the parents?
Well, it's touchy sometimes, but every family is different, and we really look at what's going on currently, what small changes we can make. In general, I would say a lot of families tend to feel like, the parents feel like they're short order cooks. That's a common problem. And so to address something like that, we would explain to them that, you provide one thing, the child determines how much they want to eat and if they want to eat at all. And that's all they get. If they don't want to eat it, then so be it, and next time they can make that decision again. And sometimes the parents are shocked by, hearing that that's the way it should be, but for the most part they understand, and it tends to work out. So that's one example of a situation that we would tackle with a family. So. And
I like what you said about small steps.
Right.
Yeah, and do the families and the children do well with it just kind of being small steps?
Absolutely.
Yeah. Mm-hmm. And how long of a time frame would the child become? Because you mentioned that there's group sessions. Mm-hmm. Is there also one-on-one?
The program doesn't have an end to it. It's, as long as the families feel like they're benefiting from the program, they can be in it as long as they would like to be, until that child turns 21, and then they would be required to move on into an adult sort of program. We ask that the families come to group sessions every 2 weeks. Individual sessions every 2 weeks, and group sessions twice a month. But they can come to as many as they'd like. And the group sessions there's usually, well, Wednesday evening group sessions, there's a topic that they learn about something in particular, and then Saturday afternoon sessions is a physical activity sessions for them to start some physical activity.
Great opportunity for them to learn nutrition and get a little bit of physical activity. And this is part of the community. It's a community resource here in Charleston, as well as it's got some connection also with the Lean team.
The Lean team has recently become involved in heart health in the process of promoting it to schools, the school districts and things like that. So the Lean team is getting out into the schools, talking about the heart health program, and hopefully getting some of the kids to us that may need our services.
Janet, if we have a concerned parent watching or parent who's interested in this, where can they go to get some more information or perhaps get their child and their family into this program?
There are a couple of ways that they can find out more information. They can go to the MUSChealth.com website and search heart health, and there's information on their podcast that will tell them more about the program and the contact information. They can also go to www.nutrition.musc.edu and that will link right to me particularly with my information on there, or they can call 843-792-4717, and that'll get them right to me as well.
Okay, and that'll give them some information on how they could get their child enrolled in the
Right,
program.
and basically all they need to do is get a referral from their child's primary care doctor, and we continue the process there. We get them started with a visit, and it's pretty much takes off from there.
Yeah, thanks for being here.
You're welcome. Thank you.